Our presentation is on educating traditional Bachelor of Science in Nursing students on safe sleep practices, with an emphasis on teaching students how to teach parents. Presenting today are Elise Ash, Sierra Gostomski, and Julia Dawson. People who also worked on this project with us are Riley Daniels, Emily Kemper, and Grace Mansweto. We decided to focus on safe sleep for our presentation because in 2019, Hamilton County had a high infant mortality rate of 9.1 per 1,000, and 14% of these infant deaths were from sleep-related causes. We also found through our research that healthcare professionals were unable to identify unsafe sleep practices. In one of our studies, 73% of healthcare professionals recommended side sleeping, and 28% of nursing students recommended prone sleeping. This is unacceptable considering the AAP guidelines of safe sleep. We also found through our personal experience that BSN students felt unequipped to talk to new parents about safe sleep. In our curriculum, we are taught the ABCs of safe sleep and the recommendations, but not how to teach parents about them. Our project goals were to educate BSN students about safe sleep practices and to also teach them how to talk to parents about safe sleep.
Through our research, we identified 4 themes. The first being high infant mortality rate in Hamilton County, as previously discussed. We also identified incorrect modeling of safe sleep in hospitals and misinformation that leads to confusion among caregivers. We found that there is a lack of proper education as well as inconsistencies with teaching in hospitals, these being concerning co-sleeping, swaddling, bumper pads, and sleeping positions. We also want to make sure to emphasize the correct teaching and education techniques. Correct techniques include assessing caregivers' knowledge, providing education to all who take care of the child, practicing active listening and non-judgmental attitudes, acknowledging their concerns, and utilizing a crib audit and pre- and post-test model. We also identified misconceptions about safe sleep. Some of these preconceived notions that caregivers may believe is that SIDS is random and predestined by God, that their baby will be safer sleeping with them in the bed so that they can watch over them closer, and that they are at risk for choking when placed on their backs. These are just a few of the common misconceptions. In our education plan, we had a video presentation with a PowerPoint that was given to the junior nursing OB clinical students. This video presentation included a crib audit and correct family teaching techniques. A pre and post test were given to the students, and crib audits were assigned for practice during their clinical time.
From our results that we obtained, we gave the students a 4-question pre-test and post-test. They were the exact same. And from 2 of the questions, the pre-test, 96% of the students knew the ABCs of safe sleep already. And from the post-test, it went up just 4%, 100% knew the ABCs of safe sleep. And these are the results of 2 of our other questions, which you can see a huge improvement in. There was a significant change in the respondents' confidence in identifying unsafe sleep practices and their level of knowledge about talking to parents about safe sleep after the education plan was implemented. So our conclusion from our research and results, students already seem to have a good understanding of the safe sleep criteria as far as the ABCs of safe sleep, but we believe the BSN curriculum should include education on how to communicate well with parents, and it should be given to students early, like in their education through nursing school. Considering the infant death from sleep-related causes is preventable, by educating nursing students on how to communicate with parents and teach them safe sleep recommendations, we hope that sleep-related infant deaths will decrease. And here are our reference slides.
Thanks for watching.